Paripurna. It's the season of joy of being complete. Avail rupees 90,000 discount on IVF treatment. Offer valid till 31st December 2023.
Hello, I am Dr. Lakshmi Priya, Fertility Specialist, GarbhaGudi IVF Center, Hanumanthanagar, Bangalore. Today we will see what are the treatment options available for the fertility issues. First, your fertility specialist will determine what is the reason for your fertility problem, so that we can broadly classify the treatment into natural conception with ovulatory induction, intrauterine insemination and in vitro fertilization. So what is natural conception with ovulatory induction is, we will give the particular type of medicine in the form of tablets or in the injection for the eggs to grow. We will aim for the mono or 1 or 2 follicles to grow in this patient. Mainly we will give this treatment for the anovulatory patients who have the irregular cycles. For example, in the PCOS woman, we will give this type of treatment. Once the egg reaches the particular size, we will be monitoring this patients with the help of scan, and once it reaches up to 18 to 20 mm, we will give the egg maturation injection, which helps for the egg maturation and the egg release. After that, we will ask the patient to have a timed intercourse with the husband for 3 to 5 days. This cycle we will be trying, and if it gets failed, again we will go for the intrauterine insemination. For the patients who have the mild male factor infertility problem, in whose their count is little less, or the motility has little having a problem, or if they have an issue with the morphology, we will advise this. And we will also advise for the cervical factor issues, or if they have tried multiple cycles of natural cycles with timed intercourse. So those patients we will be advising intrauterine insemination. Before that, we will check both the tubes are patent or not. If both the tubes are patent, then we will give the tablets from the day 2 of the cycle, and we will monitor the patient with the help of scan. Once the egg reaches the particular size of 18 to 20 mm, we'll give the injection for the egg to release. Once it releases, we'll plan for the IUI. Either the IUI will be like single IUI or double IUI. So single IUI is, once the egg gets ruptured, we will plan it after 34 to 40 hours later. Double IUI is before the egg gets ruptured, after we give the injection 24 hours later, the first IUI will be planned, and second IUI will be planned once after the egg gets ruptured. In this, the success rate will be little more when compared to the single IUI. What is the difference? Normally, the egg usually stays in our body for about, after release, 16 to 18 hours. Here, the sperms will be available before the egg gets ruptured. So once after it gets released, it naturally gets contact with the egg and then get fertilized. So the double IUI gets more success when compared to the single IUI. Normally the IUI gives a success rate per cycle of 10 to 15%. We usually advise a patient to undergo for 3 to 4 cycles of IUI. If it gets failed, then they have to step up the treatment. Then next is the in vitro fertilization, that is assisted reproductive technology. That is, in a simple way, we can call it as a test tube baby. Here what we do is, we will give the injection, hormonal injection for the patient for about 10 to 12 days, like anywhere between, it depends upon the patient's response. So here we will aim for all the eggs which is available in the cycles to grow. Once it reaches the particular size, anywhere between 17 to 19 mm, we will give the injection called trigger injection for all the eggs to get mature. Once after that, we will plan the procedure, that is egg retrieval, egg pickup, which is 34 to 36 hours later from the trigger injection. So that is the only procedure which requires the anesthesia. Here we will collect all the eggs, which we will examine in the microscope that will be done by the embryologist. They will be assessing the quality of the eggs. Once after assessing, they will process the husband's sperms, and after that they will inject the husband's sperms into the egg. That is called intracytoplasmic sperm injection. After that, we will culture the embryos or fertilize the embryos of 3 to 5 days, and we will plan for fresh or frozen cycle depending upon the patient's hormonal status and patient's endometrium condition. Then if we plan for fresh means, we will plan either day 3 or day 5 from the egg pickup day. If you are planning for the frozen cycle, we will be giving a month of break, and then we will prepare the endometrium and will proceed with the frozen embryo transfer. Thank you.